Welcome to Finer Minds. I'm your host, Shay Clary. February is American Heart Month, and on today's episode, we will be raising awareness about heart disease. Heart disease is the leading cause of death in the United States, but impacts some communities disproportionately. Hi, I'm Shay Clary. Welcome to Finer Minds. February is American Heart Month, and today I am with one of our finest members, a registered cardiovascular sonographer, Kanisha Graham. Welcome. Tell us a little bit about yourself.
But first, I would like to say thank you for having me. It is indeed an honor to be here for such an occasion, as February, which is Heart Month. I'm a registered cardiovascular sonographer, and I am approaching 11 years of experience. So I'm very grateful for that. Throughout my career, I have had the opportunity to travel to different states to learn, their protocols and how they observe the heart muscle and just the different diseases and how demographics truly play a role with heart disease.
Excellent. Thank you. And thank you for all your work you have done for the community.
You're welcome.
So tell me a little bit about the different studies that you do in your daily work that can identify and evaluate someone's risk for heart disease.
Yes, so as a registered cardiovascular sonographer, I perform echocardiograms of the heart. The echocardiogram is a non-invasive exam. And then we roughly have about an hour to perform the test. Sometimes it can take less given the image quality. But during that time, we are assessing all four heart chambers and all four heart valves. When we are assessing the chambers, we look at the left ventricle, which is the main pumping chamber, and that tells us a lot about the function of the heart and if there is any possible blockage regarding the heart. And the valves would check to see if there's any regurgitation or if there's any stenosis. And there are grades. We have trivial, we have mild, we have moderate and severe. And when regurgitation or stenosis is approaching the severe range, the cardiologist speaks to the patient about possibly replacing those valves. But it is a non-invasive exam, and it provides the cardiologist with thorough information so that they can make the proper diagnosis.
It came across my Instagram within the past 2 weeks. You have Christopher Reed, who just admitted that he had a heart transplant, I think a week or two ago. And Ray J, who was saying that my heart is functioning at 25%. Now, I'm a nurse. I know that means his EF is 25%.
Yeah.
But for our listeners, can you explain a little bit more about EF and the risk and possible outcomes of having a EF as low as 25%?
Yes. So the EF stands for ejection fraction. And so a normal ejection fraction is within like 55 to 60%. Low normal would fall in the range of like 50, 55. And so what happens is when you're in that normal range, your heart muscle is squeezing very well. But when you are in that 25 or less, or even 30, 35, because when you are at the 50, 55 low normal and you get into the 45 or 40, 45 range, that's mildly reduced. Then you get into the 30, 35, that's considered moderately reduced. 25 to 20% is severely reduced.
That's a danger zone.
And that is definitely the danger zone. So now we have this weak heart. And so where we once had a normal heart where it's pumping strong, it's allowing the blood to circulate properly throughout the heart to get to the rest of the body. Where a heart that is functioning but at 25%, just using that as the example, is stiff. So the blood is not circulating properly. So that can lead to clotting. That's why one would have to be placed on a blood thinner to help move the blood through the heart to the rest of the body. And so it also has the dangers of a possible heart attack, because now we have this stiff heart where the coronary arteries may or may not be functioning properly. So we have the risk of a heart attack. We have the risk of throwing a blood clot. And where that may go, we don't know, because it's following the circulation of blood flow. And so there are so many different risks with living with a low heart function or a low ejection fraction. And so that's why seeing a doctor, for preventative measures is so important, because it will allow us to see at least where your heart function was at 2 years ago, opposed to starting from scratch where we don't know like when this heart disease started.
Thank you. So for preventative care, what should, for our listeners, what should a person ask for or request when they go to see their doctor for their annual checkups, which are very, very important? Don't skip them. Should they ask for, or should they expect their doctor to order maybe an ultrasound or echo, or what should be part of their annual preventive care measures?
So I think how you could go about getting the test ordered is so many different measures. It could be as simple as you saying, I feel dizzy. They can order an echocardiogram. You can say, I have family history of hypertension, or I have family history of high cholesterol. Or you can, one big one is say, I have chest pain. Now that may get you everything.
Yes, it's gonna get you the full workup. Full workup and an overnight stay, maybe.
Be on the list.
Yes, yes.
It's just things like that, symptoms like that. You can say palpitation. You can just shortness of breath. I fainted, or I felt like I was going to faint. Symptoms like that will get you, qualified to have the echocardiogram done. The cardiologist will order it, and someone like myself will perform the test based off the order. But that's going to be one of the preventative measures. And that preventative measure, I believe, is kind of like high on the chart, because I do have a second recommendation, and that's a calcium score test. But you'll have the calcium score test, but then that's going to take you back to an echocardiogram and possible a stress test as well to check for ischemia. So there are several preventative exams that can be done, and they don't have to be yearly, but it's just the fact that you have a history of it, and then based off of what the first echocardiogram showed, that will then let the cardiologist know like how often you should have it done. You may need to have it repeated every year or every 6 months, but then the cardiologist may say, well, you're good, you only have to come in and see me unless you have a problem. But I think as far as preventative measures is having a baseline. Have a baseline echocardiogram, have a baseline stress test, so that in the future, if anything were to ever arise, at least we know what you look like a couple of years ago. That's why during COVID, a lot of people wanted to blame COVID for a heart disease issue, which very well that could have been true. But if you don't have a baseline, you don't know what COVID caused or what COVID did not cause. But what we do know, that because of COVID, you was brought here today, and so all we have to go by is what the studies present on today. And so it's very important to just have the baseline. It don't have to be an annual thing unless there's a problem that requires it to be an annual procedure.
Okay, well, thank you for mentioning a lot of those signs and symptoms: dizziness, palpitations, and you mentioned ischemia. So just let our listeners know what ischemia is.
So ischemia is more like when one have had a heart attack, and it deals with like a blockage in the artery. And though the echocardiogram does not look at coronary arteries specifically, we deal more so with the ejection fraction based off of how well the heart muscle is squeezing that percentage. And so based off the percentage and the visualization of the heart muscle, we can determine like which wall motion is not functioning properly. And then the cardiologist will know which coronary artery feeds that area.
Yeah.
And so if a catheterization is needed, then the cardiologist can assess the coronary arteries to see why this area is having so much lag in the heart on this side, and this side of the heart seems like it's overcompensating to make up the work for this side of the heart, which is not performing like it should. So ischemia deals more so with like a part of the heart that has been blocked, and the coronary artery cannot get blood through the regular route to the heart that it normally would. But the body is so smart. This is how one don't know that they've been had a heart attack, whether it's like a very mild one. It's because when the blood see that it can't get to the heart its normal route, it'll go another route to the heart. And so oftentimes a lot of patients don't know that they've been and had a heart attack, because our bodies is so wired uniquely that it know how to make a detour to get the blood to where it needs to be.
You know, when we talk about heart attacks, I know I'm a huge Sanford and Son fan. And we all saw that image, you know, doing this. And yes, it's the big one. And he's grabbing the left side of the heart. And a lot of people think that, okay, heart attack, chest pain, pain down the left arm. Women present a lot differently. We might have jaw pain. We might have pain in the back. I have heart disease in my family. I was diagnosed with hypertension at 25. And my symptoms were tiredness. I've always been very energetic, and I just had no energy, which was completely unlike me. And my vision was blurry at 25. So went in, got put on medication that particular day. So I know heart disease affects Black women far more than any other race of women. So my question is, what have you seen on images from our demographic more so than any other demographic? Is there anything that you may see on in your practice on our images that's very prevalent that you may not see in anyone else that might come in?
So it's nothing that I see that is more prevalent, because with heart disease, it's kind of the same across the board. So like if somebody is coming in with hypertension, depending on what depending on how long they've had hypertension, which is high blood pressure, depending on how long they've had it, and or how long they've had it but been undiagnosed, that makes a difference, right?
Yes.
So when hypertension is in place, like there are certain things based off of a patient's order or symptoms on why they come in that we interrogate certain areas. So already, if a patient is coming in with hypertension, I immediately know to look for wall thickness.
Okay.
Because one thing about hypertension is like any muscle in the body. When you work it, it gets buff. It gets bigger. And the same thing like with the heart muscle, if it continues to have to work harder over time, it gets thick. And so with hypertension, that's staying with that term, when a person has it and it has been left untreated, one thing I do want to say about our culture is that we like to be holistic. And now it's nothing wrong with being holistic. I just feel like it has a place.
Yeah.
When your blood pressure is 170 over 120, this is the time that we look to medicate
Pfizer.
as well.
We need Pfizer. We need a little Pfizer.
This is the time where we listen to the doctor's order, as well as you doing whatever you believe in your heart to do. But at this point in time, with a blood pressure that is remaining 170 over 110 or what have you, this is not the time to solely be saying, "Oh, I'm going to continue to go the holistic route.
I'm gonna keep taking that teaspoon of apple cider vinegar."
Right.
Yeah.
We got to do that and some.
Yes.
Because at this point, it's important to get that blood pressure under control.
Yes.
Because what happens is the heart muscle becomes thicker. The muscle becomes thicker. And what it can happen is it can cause obliviation, because it can cause the left ventricle to become very narrow, where it don't allow the proper blood flow to get to the rest of the body. Then that's when you are dealing with dizziness, because oxygenated blood is not getting to the rest of the body. And then you mentioned, because also too, if blood cannot get to the rest of the body, our blood also feed the eyes. That's why sometimes you have blurred vision. And that's why it can also lead to a stroke.
Yes.
So it's like everything is connected. If I can say, God has designed this body so uniquely
and perfect
that we have the signs.
Yeah.
We just have to pay attention to the signs, because having blurred vision or having any type of discomfort, feeling dizziness, those are signs. We can't keep just saying, "Oh, we're gonna brush that off." Okay, if you happen the first time, take note of it. And then if it happened the second time, it's probably time to call a physician, because there are just certain things you do not want to play with. And high blood pressure is one of those.
Oh yeah. It's the silent killer. Yep. You mentioned about the left ventricle getting larger. And I just want to go back to that for our listeners, because there's so much out there on the internet, and you see things about people sharing their health journeys and health issues. And so a word that will pop up is left ventricular hypertrophy. So I just want them to hear that word, LVH. I want them to hear that word, because you mentioned about hypertension causing the heart to work harder, and just like a muscle, because the heart is a muscle, it's going to get bigger. That left ventricle gets bigger, and that's called left ventricular hypertrophy. So I wanted to make sure that these buzzwords, our listeners know what they are. So even if the doctor mentions it to you, I mean, I know, and I'm sure you know, a doctor is supposed to explain these things at an 8th grade level. That's just what I was taught. Even if I'm educating a patient, 8th grade level, to keep it so they will understand it. And the doctor comes in and says, "Oh, you have left ventricular hypertrophy." No, most lay people are not going to know what that is. So I wanted to make sure that they knew the word that goes with the left ventricle getting bigger.
And so if I can say that the left ventricular hypertrophy, so that can be caused by hypertension. It can be caused hereditarily. And so left ventricular hypertrophy, LVH, is the same as thickness, right? And so, and there's categories even for that. You may have mild, moderate, or severe thickening. It just depends on, again, if this is due to hypertension or if this is hereditary. But it's measured. And so the cardiologist, if it's mild, you'll see LDH on your echocardiogram report. But that just goes back to the muscle thickness.
One thing that I did not mention, which is very important, exercise.
Yes.
Exercise, smoking cessation, all of those things. I do have one last question. Have you seen any reversal of maybe abnormalities if somebody starts to adopt a healthy lifestyle with exercise, weight maintenance, smoking cessation? Have you seen an improvement of any abnormalities on imaging, maybe repeat imaging? Have they gotten better?
Yes, I definitely have seen improvement for patients that have coronary artery disease. So I do know that it is possible. Unfortunately, they may still have that label because of their history.
Yes.
But with proper medication, proper exercising, and dieting and lifestyle changes, it is possible for there to be a reversal of the heart muscle getting stronger. I have seen it on several cases where the heart muscle has improved. And unfortunately, we do have those cases where some progress is slower or recovery is slower than others. And it takes a little more time and a little more management with finding the correct the medication and a correct protocol for certain patients. But to answer your question, yes, I have seen recovery in the injection fraction of patients with coronary artery disease.
Good. Okay, you hear that? You hear that? Exercise, lifestyle modification, weight management, smoking cessation. Hey, we are here to raise awareness to heart disease. And for this month of February, it's all about a healthy heart. Thank you so much, Kanisha, for joining us.
Thank you for having me.
You're welcome.
This podcast is for informational and educational purposes only. The content shared reflects general knowledge and professional experience related to heart ultrasound and cardiovascular health. It is not intended to diagnose, treat, cure, or prevent any medical condition.
Thank you for joining us for another enriching episode of Finer Minds, presented by the Sigma Omicron Zeta chapter of Zeta Phi Beta Sorority Incorporated. Stay connected with us for more episodes and community updates. Follow us on Facebook at Gwinnett Zetas and on Instagram at Gwinnett_Zeta. Until next time, continue to grow, continue to serve, and continue to embody a finer way of life.